us on the map. Mr. Caruana leading the beat. Australia global rank 6. Feeling the heat like immortality.
All right, so let's look at the relationship between technology and improving technology over time and health. So advancements in technology significantly transform individual health outcomes and reduce burden on the healthcare system. That is, doctors and other types of clinics, so whether you are institutional or non-institutional clinic, all using technology to make healthcare more efficient, all right? Making technology work for them to help the patient, as opposed to letting technology just do everything, all right? Or technology being a burden. So we're going to cover 4 different aspects as to how technology is used in healthcare to benefit people. So the first one is going to be for measuring health, okay? Measuring the health status of somebody, all right? Traditionally, the only way that you knew whether you were healthy or unhealthy is if you went to the doctor, and the doctor ran a whole bunch of tests, maybe did some physiological tests, some blood tests, all right? Testing levels, urine tests, etc. And then it would spit a whole bunch of stuff out after 2 or 3 weeks of pathology and be like, okay, this is your level of health, all right? Not anymore, all right? Portable devices, wearables, and apps empower individuals to monitor and manage their health outside the clinical setting, all right? So these days, most people actually have a pretty good idea or just a ballpark figure as to where their health is landing. And then if they feel like something's not right, or maybe one of their portable devices is telling them that something's not right, then they can go and see the doctor for further follow-up, okay? Common portable devices would be like, CPAP machines, take-home ultrasound, and like heart rhythm machines. You can use wearables like watches, chest straps, etc., and obviously apps that we use on our phones too. They all work towards measuring the health status of a person. For positives and negatives, positives, we've got the fact that it creates this proactive control over an individual's level of health. Okay, it empowers people to make positive changes. All right. Negative though. Data privacy is still always a concern. All right, some people don't want to be connected to the World Wide Web and have all their health information uploaded somewhere for someone to then hack and distribute, because people are always looking for your health information. I shouldn't be sarcastic, but I personally don't care, but some people do. And the other one is bias in algorithms. Okay, so for example, like my watch tracks my sleep every night, and the best sleep score I really ever get is about a 90 out of 100, and I can't seem to get over it. And when I go through like the app for the sleep scoring system, so because it's created from an algorithm, it says for me to get an optimal level of sleep, I need to go to bed 2 hours later than what I do. So I go to bed at 9 and I get up at 5 in the morning, but it's telling me that for the majority of people, the best night's sleep happens if they fall asleep at 11. Well, 11 doesn't work for me, because if I went to bed at 11, and I got up at 5, then I'm only getting 6 hours, and then my sleep score would go right down. But that algorithm is ingrained from years and years of historical data from, average, men who are 42 years old. So it doesn't apply to me. So sometimes the measuring health and what we're measuring it to may not be accurate for each individual circumstance. Right, the next one is looking at technology to monitor health. So once we've got that measurement, that baseline level of data, whether that was done using technology or whether that was done through the GP, specialist, etc., we can then send patients home to monitor their own health using technology. So ongoing monitoring health, once it has been measured, remote patient monitoring systems, so RPMSs, they send data directly to the GP and specialist, usually on like a daily fashion, but some of them actually go multiple times per day, on their current health status, such as blood pressure. So if someone has high blood pressure and they're at risk of having, a cardiovascular event, they can be sent home with an RPMS for blood pressure, and that monitoring gets cycled through their specialist and their GP regularly, and then they can get a phone call to be like, hey, you need to come back in, your blood pressure is not being managed well, for example. Another one, which you are probably all familiar with, is continuous blood glucose monitoring for patients with diabetes, and whether that is type 1 or type 2. So instead of them having to test themselves multiple times per day, or maybe forgetting to test themselves, it literally just sits on their body and it constantly measures their glucose throughout the day, and it will alert the patient when they need to either have an insulin injection or whether they need to bring their blood glucose levels up. And some of these monitors now even give the insulin injections themselves. So it's completely hands-free, which is amazing. So positives and negatives of this is that it's going to reduce patient admissions, saving thousands of dollars daily in the healthcare system, which is excellent. And we know we are currently in a bit of a crisis with our healthcare expenditure. So doing more of this stuff is going to save some money, which we need to recuperate. Negatives though, it can increase anxiety levels from constant monitoring. So those same people that don't like their data being out there in the big wide world, they don't like specialists, GPs, etc., knowing their level of health status at all times throughout the day. And that can increase anxiety, which can increase blood pressure, and then that can also cause further issues. So an example to show this, the CSIRO did a telehealth trial. So they used at-home monitoring systems such as our ECGs, spirometry, and blood pressure monitors for patients who are aging and known as frequent flyers, which means that they're constantly in and out of the clinical setting. So they sent a whole bunch of these guys home with all of this stuff to monitor their own levels. And what that actually did, they found that it had a decreased hospital admissions for the particular population by 53%. And if they had to go into hospital, it decreased the amount of time that they stayed in hospital by 76%, because instead of them now staying in a hospital bed and taking up space, costing thousands of dollars every day, just to have their blood pressure and ECG stuff measured, they were able to do that at home. And that was excellent. All right, so one of the big ones and how technology is assisting our health is early diagnosis of severe issues. So technology enables more accurate and early diagnosis of conditions, therefore leading to increased treatment, increased survival rates, and less invasive procedures for the patients. So it's a win-win everywhere, okay? For example, pathologies, so taking bloods, enhanced MRIs, PET scans, CT scans, they can all detect important disease and illnesses such as cancers, fractures, and therefore doing this significantly earlier leads to earlier treatment, which then leads to increased survival rate. And less invasive procedures too. If you have to get a cancer removed, for example, and it's only small, that's excellent, then as opposed to it growing and then picking it up later when it may need more significant surgery and treatment. Also, we've got 3D modeling technology these days, which is used in many, many aspects, but it can enhance surgical precision, for example, because the surgeons are able to actually see a life-size model of the organ, such as the heart, that they need to operate on, and they can determine before they open the patient up where they're going to go in, how they're going to do it, how they're going to patch them up, etc. And they can practice on this using, AI and augmented reality as well. So early diagnosis and technology is obviously going to enhance our early intervention and survival rates. Negatives though, very costly, okay? These machines are not cheap. These are not the type of things that you can buy and have one at home, all right? Usually most major cities and towns will only have a handful of these things, and you go and see your GP and your specialist, and then they refer you to a building which may have one of these. So for example, living here in Lake Macquarie, I think there is less than 5 actual places across the whole city that have access to this technology. Accessibility is also a problem, because if you don't live in a city, let's say you live further out rurally and remotely, then it's very, very hard for you to easily access these. You may need to be waiting weeks to see a doctor, let alone then waiting months to go and travel to get a scan. Or blood tests are pretty simple, but the rest of them, not so much. So explicit examples of how this is used. So the ACEMID system, which is used by skin cancer clinics. So that can basically take a 3D model of the whole patient's body and all of their skin, and it will instantly start to, like through the use of AI and algorithms, detect whether any of the moles or blemishes may be melanoma or other types of skin cancers, and then that can direct the doctor to have a closer look or maybe send some biopsies off. On a lower level, we've also got our AEDs. So I'm sure you all know what an AED is. So these can detect whether the heart muscle is in fibrillation and whether it may need a shock to put it back into its proper rhythm. So before AEDs existed, you had to wait until the ambulance came and you would be doing CPR, etc. But nowadays, through early diagnosis of this, we can correct it on the spot if you have access to an AED, which therefore enhances outcomes from people having heart attacks, etc., significantly. So the final one we're going to touch on is precision surgery, okay? There are amazing surgeons in the world, and surgeons still have to use the technology to make it happen, so it's not fully automated, but the advancements that we've had in technology of surgery allow for certain procedures to be done which couldn't have been done 10 years ago, even 5 years ago. So technology is going to lead to procedures being more accurate and less invasive. So not only are we able to specifically make incisions and remove certain tumors, etc., where they need to be removed without removing extra tissue, they're able to perform these surgeries in keyhole manners, which means that the surgery itself has a smaller cut to go inside the body, and also there's less chance of infection and other type of bacteria and stuff going wrong with those procedures. So just general examples, you've got robotic assistance, advanced tools for surgeons, augmented reality, so surgeons can practice these things before actually doing it on the patients, and also using 3D modeling, which we talked about before. Overall, this is going to improve patient outcomes, and the main patient outcomes we're looking at here is reduced recovery time and increased success of the procedure, and leading to less likely having to have a follow-up procedure. The negatives though, spoke about them earlier. Cost and access, okay? Once again, if you are using a robot system such as the Da Vinci Xi, not everyone's gonna have one, okay? I've never seen one. I'm assuming they're, probably reserved for super major cities like Sydney, for example, okay? And there's probably only like 1 or 2 in Sydney. I'll look it up and I'll find it and I'll put it down here in like a little note. And access, all right? So obviously not only cost as a barrier, but actually getting to use these is going to be a barrier as well. So explicit examples, we've got the Da Vinci Xi surgical system and the Simini surgical systems. So these two are different, but they basically work in the same way. They allow enhanced precision for surgeons to be able to make incisions and remove tissue, etc., on microscopic level. So procedures less than 1 millimeter in size, okay? So that's super tiny. I can't even cut toast without, getting the line wrong, but, anyway. So and this is really good on things like blood vessels, right? So think about capillaries where it's all meeting up if we need to make an incision there, or in the heart where you don't want to be making too much damage because that can be ongoing, etc. So these systems are amazing. Also, we've got the NuVasive Pulse system, which uses neuroimaging and monitoring to basically ensure that spinal surgeries are more successful and have less negative outcomes for patients, because in the past, a lot of spinal surgeries, they don't have a tendency to go wrong, but we know that if we're operating on the spinal and nervous system, if something does go wrong, it's pretty drastic. So these systems enable those to happen with more precision and less error. So overall, the relationship between technology and health is a really positive thing, and it's only going to get better and better as we go. Yes, most of the time it's going to enhance our patient outcomes, but there are cost and other barriers related to accessing that technology. Thanks.